Good morning. We're joined today by the Sleeping Beauty, Helga. You've probably seen her in some of the other videos in the background, but I'm using her bed to do my demonstration today. So today we're going to talk about lymphatic drainage. I'm Shantae Marker. You can see some of my other videos at Shantae Marker, and they'll discuss contrast therapy, some of my insights since my Acdf, mistakes I've made, and pretty much just what it looks like day to day. There's a lot of video out there that's fantastic. I got a lot of good tips from some of the other videos. However, a lot of what I found was, 5 years old. So I'm hoping that if people like this and it gets a little more traction, maybe this more recent video will bubble up to the top. So please take the time to like and subscribe and comment, if you will. Lymphatic drainage is super easy to do. A lot of people do it on the daily just so that they can get rid of fluid in their face and their neck, just as a beauty treatment. And of course, lymphatic drainage is a medical type massage for people with lymphedema. I've been using it as a massage therapist with a lot of my clients that are having plastic surgery, tummy tucks, mommy makeovers, liposuction, all that sort of thing. And so the thing that you just need to know as a layperson is that the touch is very, very gentle. So when we're working remotely away from the incision or the swelling, the pressure can be a little firmer, like a very gentle compression. But when we're working in the delicate areas where the incision is or where the swelling is more observable, the pressure is going to be so gentle that it's almost, we call it a feather stroke. It's almost like the stroke of a tickling, a gentle, soft tickle. But again, it's pressure that you would feel comfortable using on a small child. So very, very gentle, gentle, gentle. And so I'm going to do a demonstration as opposed to giving you a lot of explanation on anatomy and the lymphatic system. Let me just show you what I do. So I start at the lower left quadrant with 8 to 10 gentle compressions. I'm only going to do 2 for the purpose of the video. I slide up to the upper quadrant of my abdomen and then across to the right side and then down to the lower side. And I may do that twice through, but considering I'm doing 8 to 10, usually once is enough. And then from that abdomen and all those deep lymphatic lymph nodes, I then go to the breastbone. And the idea is we're trying to stimulate the thoracic duct and all the lymph nodes and the lymph vessels to move fluid out of those areas and make room for the new fluid that we're trying to move through diffusion, if you will. So then next I would go to my armpits and do a couple of squeezes there. Most of us are familiar with those lymph nodes that can sometimes get sore in the armpit area. And then in my own practice, I would then wash my hands, but since this is video, I'm just going to spray them with some antiseptic spray. Also, my incision's closed up, so I'm not really worried about contaminating it, but if in the beginning, you may want to use gloves. I didn't use gloves, but I was meticulous about washing my hands before I touched my chest, neck, and throat. And so then I'm going to go a little bit farther away from where my inflammation tends to be, which is in that clavicular notch right here. And the stroke, like I said, it's very gentle. It's got almost a little bit of a circular motion. And so I'm starting away and I'm working in the direction of away. So if the swelling's up here, my stroke is always going to be downward, sort of cuddle stroke. And then I work my way towards where the inflammation may be. Always trying to make room for what's to come. Working underneath the collarbones. And then jumping the clavicle into this little triangulated section. And then I come right up to either side of the ear with this sort of scissor stroke on both sides. And I don't know if you can tell from the video, but I'm kind of floating up and then pulling down. So I'm not rubbing up and down. I'm releasing tissue at the bottom and then coming back up and gently sinking in and stroking downward. And then a little bit more into the throat. I had a lot of swelling in the back of my neck as well, especially at the bottom of the neck. So you may even want to use some of those strokes in the back. And then again, coming around like a necklace and back down. And then I like to finish again with some gentle compressions on the breastbone. And you can even go to those abdominal sections again, the lower left, the upper left, the upper right, and the lower right. And maybe even some nice circles. And so we're just going in a circle from left to right and back to left. And so I do that about 10 or 15 minutes. Now that I'm on week 4, I'm only doing it maybe once a day or once every other day. But in the beginning, I was doing it a couple of times a day. And if you refer back to some of the shorts that were text videos I sent to family members early on, you can see a lot of bruising in my neck from the collar. And like I said, this worked wonders to dissipate that bruising. Have a great day. See you next time.